Today I'm going to discuss about basic catheter, and I'm going to have pictures like right here, right here, here. So anyway, first of all, basic catheter is basically a thin tube often made of soft plastic materials, which is inserted into the body. So the function of basic catheter is of course to drain urinary bladder when it cannot be emptied normally. This process is known as catheterization. It is basically used for people with dysfunctional bladder disease that could be neurotypical, maybe like Parkinson's disease, spinal cord injury, spinal bifida, or maybe even multiple sclerosis. And there are different types of catheters. The first is indwelling catheters. So indwelling catheter is basically catheters that stays in your body for a longer period of time, and it's changed mostly around 2 months or 1 month like that. And there's two types. One is the urethra, basically the catheter is inserted through the whole of your urethra up to your urinary bladder. Another is the suprapubic catheter, where it's inserted from the stomach to the urinary bladder. It's what I call as an intermittent catheter. Intermittent catheter is basically something you insert it, and then after it's finished drawing out the urine, it get inserted out. It's a short-term use urinary catheter, and basically it must be done. This process of catheterization using intermittent catheter must be done around 4 to 6 times a day, and it's for a shorter period of time, of course. Now there is also different type of tube for catheters. One is the hydrophilic tube, another is a non-hydrophilic tube. Hydrophilic tube is considered the more efficient one. Basically, it allows the urine to be able to be drawn into the tube much faster and more efficient. So which catheter we use? Basically, most doctors prefer to use, most doctors or nurse prefer to use intermittent catheter because it doesn't stay longer, it doesn't stand that long in your urinary bladder, and hence it minimizes the risk of infections. On the other hand, indwelling catheter is used for those maybe in hospital that is short staff and they do not have that much time to deal with one patient. There's like a lot of patients, especially during this COVID-19 area, and maybe indwelling catheter would be would be the way to help the doctors and nurses to be less stressful at work. Now we're gonna move on how do you correct urinary output through catheterization. So first of all, you need to prepare a sterile field next to the patient bedside. You open the outer packaging of a catheter part onto the trolley and decontaminate your hand. The procedure will be, first of all, wash your hand, then put on your sterile glove on. Take the sterile drape and tear a hole in the center, draping over the genital area of the male and female. Use at least about 5 cotton wool balls to clean the gland of the penis and the penile self, and for the females will be the part of the labia. Now hold the penis erect and inject the lubrication gel into the urethra. It will be to inject the gel into the urethra of the female. And then now you remove your glove again and decontaminate your hand or wash it. Carefully open the catheter and syringe onto your sterile field. Open another sterile glove package. Wash your hand or decontaminate your hand. Put the sterile glove on and open up the syringe. Place the gel trail between the patient's legs. Carefully open the catheter from its sterile packaging, exposing only the catheter tip. Without touching the catheter directly, insert the catheter along the urethra into the bladder. Once the urine begins to flow, advance the catheter a further 5 cm. Inject the contents of the syringe into the catheter to inflate the balloon in the catheter, and gently withdraw the catheter to ensure that the balloon is secure against the bladder neck. You will feel a resistance when you try to inflate the balloon, and then basically you try to withdraw it, you will feel a resistance when you try to withdraw from the bladder. And then finally you attach the catheter to the drainage bag. Attach the drainage bag either to the patient leg and tape it, or the patient bed, or the catheter stand. And then pull back the foreskin back to a normal position for males. Discard all waste into the collection disposal bin and ensure the patient is comfortable. Remove your glove and finally decontaminate your hand.